I'm Greta Gill, midwife, and I am here today to give you a tour and orientation of the Midwifery Center at TMC for Women. I am at the southeast entrance of TMC for Women, and this is where you come to have a baby. Come with me and I'll take you on a tour of the facility. This is the admitting desk. This is where a mom in labor checks in. We highly recommend that you pre-register. It makes the admitting process go by much more quickly. You check in here, you get a wristband, and you go to triage. Welcome to Labor and Delivery Triage, where we begin your labor care. I'm here with Anna. Anna is a charge nurse in the Labor and Delivery Triage area. Anna, will you tell us what happens when women come to this area to see if they're in labor?
Sure. This is going to be the first place that you stop when you think you're in labor. It's our new triage unit, and we will show you into one of our rooms and listen to the baby's heartbeat and see how often you're contracting and give the midwife a call.
And how do you tell if a mom is in labor?
The midwife will do a vag exam, and if you're dilating and you're changing your cervix, then we will admit you for labor.
Okay, and what happens if you get here too early?
If you get here and a vag exam's done and you're not in labor, then you are given the option to go home for a little bit longer or to walk here at TMC.
And there are a lot of hallways at TMC. You can go quite far and walk until you're in strong labor.
Yes.
From Labor and Delivery Triage, the Midwifery Center is a short walk through labor and delivery. We're here at the entrance to the Midwifery Center. The Midwifery Center is tucked into a nice, quiet, private corner of labor and delivery. This is the Midwifery Center Lounge. This is a waiting area for the family and support people who are helping you in birth. We also have several waiting areas in the southeast entrance of the hospital, as well as on labor and delivery for your extended family. This is the Midwifery Center kitchenette. You are welcome to bring your favorite snacks or foods from home and put them in the refrigerator here. You can order in food from outside restaurants, or we do provide some light snacks and teas. Additionally, you can order from TMC's food service. This is one of the 2 birth rooms that we have in the Midwifery Center. You'll notice that the room is equipped with a queen-size bed to give it a homey and comfortable feel. The queen-size bed is also useful to allow moms to adopt a variety of positions to cope with labor, as well as for support people to get in and help with massage and acupressure and other techniques to help with the pain of labor. In both of our birth rooms, we have deep water birth tubs. These are tubs built specifically to use during labor and birth. They're quite deep and large. They do have enough space to hold mom as well as a support person. Most of our moms do get into the tub and use the hydrotherapy to cope with the pain of labor. And you also do have the option to have a water birth to give birth in these tubs. When a mom is in labor in the Midwifery Center, we don't use electronic fetal monitoring. We use handheld fetal Dopplers to listen to the baby and make sure that baby is doing well. This allows mom maximum freedom of movement, which does help the labor progress and ease the pain of labor. The rooms also have large showers. So some women find that being upright or standing in the shower is helpful to go through labor. We have every size and shape of birthing ball, including peanut balls, available for moms to use. We also have a couple different styles of birth stools that you can use during labor or for the pushing stage of labor. Our Midwifery Center birth rooms are equipped with aromatherapy diffusers. We do have a selection of essential oils, but you're welcome to bring your own. We also have Bluetooth speakers, and you can hook up to them and play any music that you like. The Midwifery Center is accredited by the Commission for the Accreditation of Birth Centers. The accreditation is our commitment to providing families with a low intervention and physiologic birth experience. In the Midwifery Center, we do not use medications to induce or speed up labor. Additionally, we do not perform forceps or vacuum-assisted or cesarean section deliveries. Those services are available right next door in labor and delivery. If a woman requires or requests pain medication, we do have some short-acting pain medication here to use in the Midwifery Center. However, we do not provide epidural anesthesia. There are occasions when you may not be able to have the Midwifery Center birth that you planned. This is one of our labor, delivery, and recovery suites where you will be cared for if you risk out of the Midwifery Center. To ensure a safe birth, we perform eligibility screening on every mother interested in giving birth here. Determination of eligibility is ongoing, beginning with risk factors prior to pregnancy and continuing until after the baby is born. Some mothers have health conditions which risk them out of birth in the Midwifery Center completely. Some examples are high blood pressure, diabetes, high body mass index of more than 35, history of cesarean birth. During pregnancy, health assessment is continuously performed by nurse midwives at El Rio Health. If certain complications arise, they will risk the mother out of giving birth in the Midwifery Center. Some common reasons are premature birth or overdue pregnancy, gestational diabetes that is not well controlled, a malpositioned baby such as a breech, or the water breaks without labor beginning. Once labor has begun and a mother is admitted to the Midwifery Center, there are some situations in which a change of plan may be advised. In this case, the mother is moved from the Midwifery Center to labor and delivery. The most common reasons to risk out during labor are meconium staining in the amniotic fluid, non-reassuring fetal heart tones, long and slow and non-progressing labor. When pregnancy has been healthy and the mother gives birth smoothly in the Midwifery Center, women and newborns are infrequently moved to a higher level of care. Some situations where such a move may happen are a mother having excessive bleeding or infant having breathing or feeding problems. On average, of the healthy, eligible mothers who want to give birth here, 35% will risk out before labor begins, 10% will risk out during labor, and 3% of mothers and newborns will need a higher level of care once the baby is born in the Midwifery Center. After the baby is born, the usual length of stay in the Midwifery Center is 4 to 12 hours. In the Midwifery Center, as well as in labor and delivery, the golden hour is observed for every baby. What that means is that the family has an hour of undisturbed bonding time and the baby is left skin to skin, and that has benefits to ease transition for the baby from being inside of mom to outside of mom, as well as to get breastfeeding started on a good foot. For the families choosing to go home in 4 to 12 hours, follow-up care is provided on the next day by nurses and midwives from El Rio Health. In addition to checking on mom and baby to see how everything is going, we perform the usual newborn screenings after 24 hours of age. Of course, you don't have to leave 4 to 12 hours after giving birth. If you want or need to stay overnight, then moms and newborns are moved over here to the mother-baby unit. If you're planning the early discharge option, 4 to 12 hours after giving birth, then you come here to the mom-baby unit to take the discharge class by 36 weeks of pregnancy. If you do choose or need to stay overnight in mom-baby, the minimum stay is 24 hours. And all moms who stay overnight come and take the discharge class on the day they go home. Thank you for coming on the tour today with me. If you have any questions, talk to your midwife, or if you need to find a midwife who practices at the Midwifery Center, click on the link. Thank you.